go ahead and take a moment and introduce yourself in the chat. If you let us know your name and where you're from, and also perhaps what line of work you're in, that would be great. And make sure that you say to everyone, not just to participants, so that everybody can see. So again, thank you all for joining. I'll wait another moment or two to begin. Again, welcome to the SHP and ABC Ethnobotanical webinar series. I'm delighted to have you join again. I'm going to share my screen for a moment. I'm delighted today to be speaking with Dr. Stephen King, who's going to be speaking about the development of Crofelemer, which is an FDA-approved drug, and he'll talk more about that. And the conversation is really going to be looking at the process of working with communities, supporting indigenous knowledge, biological diversity, and the overall role of that in global public health. Sorry. And we'll continue this series. The speakers for March 4th, we're still finalizing those, and that information will be up on our website as soon as those speakers are confirmed. And then on April 8th, I'll be speaking with Kelly Bannister about indigenous practice. And all of that information, as well as all of the recordings from previous webinars, can be found on the Sustainable Herbs Program website. And in addition, we have a series on the SHP Toolkit, which is really about educating, bringing and inspiring more sustainable practices in the botanical industry. And on February 18th, we're co-hosting a webinar with the Union for Ethical Biotrade. And that'll be looking at herbal tea sourcing with respect. And we're speaking with two different producer groups, one from Georgia, the country, not the state in the US, and the other with a producer group from Croatia. And then on March 18th, I'll be speaking with farm managers. I'm really excited for this one about Danielle from Trout Lake Farm and the farm manager from Aboca, which is a 100-year-old organic farm in Italy. And so again, that information will be on the Sustainable Herbs Program website, as well as registration information. All of these webinars are made available for free through the generous support of the Sustainable Herbs Program Sustainable Herbs Program underwriters and donors. And you can see the names of all those companies there. Find out more information again on the Sustainable Herbs Program website. And support is also made possible through the generous support of ABC members. You can find out more information about becoming an ABC member on the American Botanical Council website. And so with that, I'm gonna stop sharing and introduce the speaker for today, Dr. King. Dr. King is an ethnobotanist who's conducted field research on the use of plants for food and medicine in the highland and lowland regions of South America, Africa, and parts of Southeast Asia for over 42 years. He holds a PhD in biology with a focus on ethnobotany and economic botany. I first learned about Stephen King and his work with shaman pharmaceuticals and the Healing Forest Conservancy when I was working at Cultural Survival in the early 1990s, and I came across an article he'd written, and I confirmed the date in 1991. And I was struck by that work at that time because no one else I knew was really talking about using botanicals from the Amazon in a way that really respected indigenous communities and biological diversity, and that was talking about doing that work in terms of reciprocity rather than extraction. And so it's a real honor, and I'm thrilled to introduce you today and to have the chance to speak with you more about this work that you've been continued to do, for all of that time. So welcome.
Thank you.
Did you want to say something, or can I jump in?
Yeah, actually, I did want to say just very briefly some thank yous, because I want to forget at the end. I wanted to thank you and Mark Lewenthal for having this, making this program and having me, and also for you doing this. I think it's extremely timely and it's fantastic. I've learned a tremendous amount. I want to congratulate you on your upcoming book. Can't wait to see it. I've already ordered mine. Important stuff. I'm quite serious. I also want to point out from the outset that everything that we're talking about that we do here was based on, and is based on, traditional indigenous knowledge. That we built this product, this company, what we're doing, and without that ethnomedical traditional knowledge, we wouldn't be here. This product wouldn't be here. It's the foundation. And as you know, there is tremendous ancestor worship and homage in many cultures, reverence for their antecedents. And I feel obliged to mention that the conversation we're having is not about what I did, it's about what a whole lot of people have been doing for 3 decades. And we did have a scientific strategy team in the beginning who helped us, and I'll talk more about that later, but a number of them have passed along, and I wanted to pay homage to them. I want to say their names out loud because they guided us. And those include people like Dr. Richard Evans Schultes, who's been the mentor to Wade and Mike Balick and Paul Cox and so many people. He mentored me. I didn't quite get through the Harvard system, but as well as Koji Nakanishi, a natural products chemist, one of the world's leading ones, Robert Raffoff, a chemist, Ted Anderson, ethnobotanist who worked in Thailand, Jim Duke, Norm Farnsworth. They were all part of what helped us. And then there's a bunch of people that did that work who are still alive, such as Elaine Lizabetsky, working with us now, Maurice Ewu, Tom Carlson, Mark Plotkin, Charles Limbach, Mike Balick, Tim Johns, a whole host of people that contributed from many different disciplines to help us get where we got to. And of course, that doesn't even touch the indigenous partners, communities, and people who have been working and helping us for so long. So thank you for letting me point that out. I also have to mention 3 key people that helped make this process come forward, which include Lisa Conti, our founder, my colleague now for more than 30 years, and David Season, who's the manufacturing natural products expertise person who created the system of extraction and purification, and Pravin Chaturvedi, our chief scientific officer. These are just a handful of the people that are part of this large consortium.
That's great. Thank you for bringing everyone into the room. Before turning to the actual development of this medicine, can you talk a little bit about your background? Was there a particular moment or experience that made you think, oh, this is what I'm going to do?
Yes, absolutely. There was. It's a fascinating story. I read a book when I was 13 called Keep the River on Your Right by Tobias Schneebaum, interesting name. And that gentleman got lost in the Peruvian Amazon and was basically embraced by an indigenous group who took care of him. He spent quite a bit of time there. He actually ultimately was interviewed by Dick Cavett about his experience, and he wrote this book, Keep the River on Your Right. I read that book. I was intrigued by indigenous things in the rainforest and basically wanted to do something like that, not necessarily get lost, but work with people. I did do 16 inoculations in the Guatemalan highlands with the Friends of the Americas, Amigos Las Americas. So I had a taste of the tropics, and I liked it. After reading that book, I went to school in Maine, and those cold Maine winters, I'd be reading that book thinking about the Amazon, and managed to get my way down there with another colleague from the Chicago area. So that I knew early on, I kind of wanted to do that.
And how did plants come into that?
I got a unusual internship as an undergraduate to study the diet medicinal plants of the Siona sequoia Indians, Anguatera sequoia, in the northern Peruvian Amazon for a Peruvian anthropology organization, the Centro Amazonía de Antropología y Aplicación Práctica. And they wanted me to do that. I didn't know a lot about plants. It's a long story why, but I got this opportunity. I did it. I was intrigued by that. I collected medicinal plants and food plants, weighed diet and stuff like that. When I came back, Tim Plowman in Chicago said, oh, you got to go see Schultes because you've just been working in the area that he loves. And when I got to see him in Cambridge, he said, oh, you've been in my country because it's the Northwest Amazon, Colombia, Ecuador, and Peru. And that sort of tracked me into ethnobotany. Although I will tell you, at one point, Ted McDonald, one of your colleagues from Cultural Survival, I was seeking guidance. He said, yeah, you know, Anthropology is fantastic, but you got a better shot of finding a job somewhere if you sort of take the ethnobotany track. I'm not sure, he wasn't thinking about this kind of job, I don't think. But so he was a mentor too, whom I admire.
That's interesting. You should have told me that too. Anyway, and so you have followed that track and carved out this role that seems quite unique, the work that you've been doing. And so can you talk some about that and how you all, I don't know how detailed you want to go or not, but just tell the story of developing this drug and the issues you've been paying attention to along the way.
Yes, it is quite a long story. It's about 30 years. In fact, I love to do this because Mark Blumenthal said we could have fun. So this is a timeline of the 30 years. I'm going to start here at the first year. Now, I'm just kidding. So we worked together with scientific advisors looking at plants used by indigenous people to treat various diseases. We conducted field work in about 25 countries over 10 years, ethnobotanists and physicians working together with local healers and physicians. We basically said it took two of us to equal one healer because they have the knowledge of botany as well as the knowledge of medicine. We collected many different plants. We looked at many different plants, obviously looking towards pharmaceuticals, but listening to some of your other programs, what made it unique from a farmer perspective is that we were mission driven. We had a focus on reciprocity, benefit sharing, sustainability, conservation, and that informed how we created our relationships with people and communities along the way. So one of the first ones that we came in contact with in terms of plants was Sangre de Drago, Croton lechleri, which is ubiquitous and well known throughout the Northwest Amazon and South America and used by many different people, by mothers, by healers, by shamans, by grandmothers, used in urban markets, rural markets, also in international trade. So it was among the top candidates that we looked at, and we began pursuing it actually for a different indication, but put all the pharmaceutical focus on that compound, among others.
Can you talk back up a little and talk about where that attention and concern for indigenous communities, mutual relationships, what were the seeds for that and how did that unfold?
Sure. As you can imagine, anybody that's had the privilege as an ethnobotanist or an anthropologist to work with local communities tends to have a certain, I would say, ideally appreciation, open heart, and respect for the richness of the people, the cultures, and the places. The ethnobotanists that we initially gathered to help sort of create the strategy of how to do this all had the same value system, which was, I'm not doing this the way it used to be done. We're not going to do this in the 19th century colonial approach. There's going to be a benefit sharing mechanism. There's going to be reciprocity. We're going to work at it little by little, and it's going to be a core part of the mission, which included sustainability. Because we put a lot of resources into long-term sustainable research long before a product got approved, which is almost a luxury in that some of the phytomedicine herbal things, they come fast. People are developing products and getting them out as fast as they can. So it was a part of a quadruple bottom line: the environment, people, communities, patients, and stakeholders and stockholders. That from the outset.
Mm-hmm. And so then can you talk are there stories or moments from along that journey of the challenges that you face? It's a great idea to not repeat the colonial problems of the past, but it's
right.
Challenging in a world that's with such inequities. So
absolutely. I almost don't know where to begin. Fortunately, we published a lot of these things in articles, which have now kind of passed. But the most important part was having conversations and agreements long before anybody did anything, which meant working through partners in various languages, talking to communities about what we would like to do, what our goals were, what we would be able to offer in terms of reciprocity, immediate reciprocity. And as everybody who's lived with traditional peoples know, as Wade talked about it, and Mike and Paul, that is the foundation of traditional cultures, is a reciprocal exchange. There's much less focus on individual ownership or individual well-being to the exclusion of the community. So having seen that in action, it's a slow process that involves discussion, dialogue, and investment of time, asking about what communities would need. We put about 10 and 15% of our research budget and any given expedition, if you will, toward direct reciprocity. That would, we wouldn't sit and think, what do we think they might need or utilize, but rather what the community through their own process and discussion would say, this is some priorities we have that we'd like to have some assistance with. I noticed you mentioned to me that you've seen things not always go so well, say in Nepal with well-intentioned programs. We didn't have any illusion that we were going to be the USAID long-term development program with all the positives and negatives that might provide, but rather something that could be tangible and specific. Clean water pipes in Borneo, hospital beds and mosquito nets in East Africa, a longer landing strip in a small community that needed to make emergency evacuations from time to time. So it was always different, and it took time. It wasn't easy. You couldn't do it like, hey, we got to figure this out next month. In some cases, it took us 2 years to get that worked out, say, in Borneo.
When you're talking, it makes me think of Wade's response to my question about whether you can change, making change, and that it depends on expectations. And he isn't expecting that you're going to change the world. And so then things can be more right-sized in a way, or...
Yeah, I think that's absolutely true. I think that I was thinking that part of what makes things go south is when there's inappropriate expectations on both sides of what might be able to happen and what was promised to happen but didn't happen. So yes, I agree.
So keep talking, telling story, you know, but you can go into as much detail.
It's really been a joy actually to do this. I guess challenges and lessons learned. Working through the community at large versus an individual is very important. As you mentioned, some things you mentioned to me, at times resources can get siphoned or funneled off into a specific, you know, a chief or one small sector of a community. So having things being really transparent and in writing and done well in advance makes a huge difference. Also, I just said setting expectations. There are challenges when communities have been told certain things may happen that don't happen. So we always made a point of following through on everything we said we would do. And that's huge.
And there's also something in the structure of how you're working. I think when I was reading the Herbalgram article, you know, there was a whole list of colleagues that you were co-authoring with, and you have partners that are...
Absolutely. In fact, those people, Mario Parillona is a forester who worked at Oxfam for 8 years, at the Field Museum for 10 years. I consider him a national treasure of Peru. He's been all over remote areas working with communities. Cesar Lozano and Codex Garcia, his colleague. These are people that we've had relationships with for 26 and 27 years, and they have had relationships with communities. I've been able to go to those communities and talk with those individuals, and those relationships, those people with the right value system is huge, because I know that what they're doing and how they're going to do it is ethical and appropriate, and they have it in their heart to do the right thing, and that without those kind of connections, you can't make the rest of it work.
I know when I was doing research following herbs through the supply chain, and I would ask so many people who work for companies who would be sourcing, how they would know that the people they met they could trust, and everyone said they would make mistakes, and that was part of the process, and that was kind of how you learn how to form partnerships that can work.
Without a doubt, we've had plenty of things that didn't go exactly as we had hoped, and we've also learned that humans are humans. Not everybody fulfills what they said they do on the other side. On the other hand, it's a small world, and long-term relationships tend to be very useful and positive. The difference perhaps is in that we've just been sourcing one particular species, you know, for all this time in various countries, enabled us to focus on that, the biology, the ecology. And I must say, part of what has made this sustainable and efficient and effective is no great testimony to myself or any gringos. It's the plant itself. It's a pioneer species, produces 500,000 seeds twice a year. It's almost like the way coffee has domesticated humans. It's now all over the world. This plant is all over the Northwest Amazon, which lends itself extremely well to sustainable management. And that can be a challenge with other species, depending upon where and who and how, and the demand.
Mm-hmm. So now can you talk some about this particular species and where it's growing and how it's harvested and
Absolutely. One thing that you mentioned, that Herbalgram 125, issue 125, there's a nice article in there that goes into some of the details, but it's a pioneer species, as I mentioned, that's distributed through Colombia, Ecuador, Peru, and Bolivia. Produces, as I said, 500,000 seeds once or twice a year. The approach we've been taking is a combination of wild harvesting and cultivation, reforestation. I feel strongly that there needs to always be a wild harvest component for the communities that wish to and are involved with that aspect of their environment, not just to have it be a cultivated thing. We also do what we would call encouraging regrowth. So after harvesting, actually helping trees continue to grow that we didn't plant, as well as paying communities and colleagues to plant sometimes up to 100,000 trees at a time in an agroforestry system. So these are not monocultures, these are really utilizing, in some ways, the particular brilliance of the communities and how they manage their resources. We don't tell or dictate ways to do it. We actually learned from the communities about how they manage plant the resource. In fact, I think we made this manual about 12 years before we actually got to market. It's in Spanish, it's got illustrations, so it's a sustainable harvesting manual, which is pretty common these days and a great thing. But we put a huge effort into that, and then the flow of activities with the community. So it's not even just sourcing and purchasing material, but then promoting and supporting reforestation programs where there is additional flow of resources. And we frequently have communities coming to our colleagues saying, we would like to participate in that, partly because there's both the ability to generate revenue as for selling and harvesting, as well as reforesting.
And so I might have missed part of this because I froze, but this is a resin that's tapped. And then can you describe that? Have you described that process of the tapping and then where it goes from there?
Certainly. So it's in our case, it is not tapped. In traditional medicine, they actually take small amounts, like Living Pharmacy, around their homes for wound healing and diarrhea and other applications. In our case, we collect the entire tree and we score it every 15 centimeters. It drips into containers. Those containers are then put into 55-gallon drums. Nothing else is done at this time. Then it's shipped to either India or Italy, where the purification and extraction takes place. Then that pure API is sent back to the United States, believe it or not, where it's made into the actual pills that are sold for the one indication, HIV/AIDS, chronic diarrhea, non-infectious diarrhea, which is currently on the market today in the United States. We kind of have a One Health approach in that we sell products for animals as well. We're soon to have the first approved chemotherapy-induced diarrhea drug for dogs sometime in October. And we're conducting clinical trials for humans in the same indication. But also we have some for dairy calves and foals. So humans, animals, dogs, a bigger complex of access.
There's a question that kind of relates to that I wanted to bring in right now. That's by Mary Johnson, who was asking how, given the many challenges indigenous communities face today, versus how much money a drug company makes off the products developed with compounds initially uncovered through ethnobotanical wisdom and cultural tradition, is there any talk in the industry of going back retroactively and giving back at a monetary scale that is much more equitable? So this question, how to talk about a lot of money is made at the top and not a lot at the bottom. So just love to hear your thoughts and how they've changed maybe over the 30, 40 years you've been involved.
That's a great question. So first of all, we're a bit unique in the pharmaceutical industry. Nobody does quite like what we do. So we don't have a lot of conversations with companies about how they might approach benefit sharing retroactively. Having said that, it's a great idea how to get companies that have benefited from many drugs have come from plants and indigenous knowledge to possibly examine or explore ways to provide benefits and retroactive sharing. That could be a tough ask for the other sector of the industry. I can't in many ways speak on their behalf. I can say that what we're doing and are doing, we've put several $1 million back into this country, particularly of Peru, over the past couple of decades. And that the reason for that is in part, it's the right thing to do. It's also the business relationship we have. This can't be made synthetically, so we are tied. We're interdependent with our partners in the forest to create this material. So I think doing it positively is the best that we can do. Getting people to go backwards and then repay, if you will. That sounds like a tough one. On the other hand, I think it'd be a great idea. We're seeing some of these things, reparations being discussed with Afro-American communities. By the way, happy Black History Month. So it's not out of the question, not out of the possibility that over time that could be, something that is done. I think it'd be a great idea, but I'm gonna stick with doing what we can do.
It's interesting. I hadn't really realized fully the difference that because this can't be synthesized, you can't just take the chemicals and then synthesize in a lab and you cut off your tie.
That's correct. It's got 35 chiral centers. It's real complicated. It can't really be done. We knew this from early on, so I was able to get resources. It's kind of what makes us different as an approach, is that we made a lot of investment in studying the long-term sustainable harvest, biology, ecology, sociology, the works, had anthropologists, botanists, foresters, ethnobotanists, economists, looking at the dynamics of this long before we had a product, because we knew it couldn't be made, in this case, synthetically. And we would certainly look at things that are possibly synthetically made, but we were actually kind of delighted that this relationship kind of kept us interwoven, and will for the future.
Mm-hmm. It's interesting. I'm just struck again from how long you and Lisa and the other team have been working on this one product.
Well, I got to say that this I'll make short, but what's really exciting about it is sort of now it's a pipeline and a product. We have the one that's approved, and then we're doing the clinical trials for chemotherapy-induced diarrhea, which is actually a big problem both in the U.S. and worldwide. We're also looking at this potential long-haul COVID GI syndrome that is associated with people who get COVID. They have these long-haul problems, including, amongst others, gastrointestinal problems. So we're hoping to get that developed for the European market. There's a short bowel syndrome application, a different formulation, same compound for kids that are born without the ability to digest food. And we're working on getting an oral one that can be given to those kids, and they may be able to then eat and have a somewhat more normal life. And then the one I'm most excited about is a different second-generation extract, all from the same species, for cholera treatment. And we know it'll work because we've done tests with related compounds, actually even with cholera patients. So what's amazing is this is one plant, one product, but it's got all these potential ramifications, public health, animals, humans. So that to me is testimony to the richness and the extraordinary potential of traditional medicine. And yeah, there you are.
Yeah, so, and it all.
Since I'm gonna add a little more to that, because at the moment we are still looking at potential new therapeutics, even in the area of entheogens. We have some of the same scientific strategy team working with us, Elaine Zabetsky, Mike Balick, and now Wade Davis, Tom Carlson, colleagues who work with us historically, some of them, to look for new sources of plants for mood disorders, anxiety, depression, addiction, that sort of thing. And as you know, this is a new frontier in medicine. It's quite astonishing, and a lot of the compounds that other people are looking at also came from traditional medicine. Iboga from West Africa, psilocybin from Mesoamerica, mescaline, peyote. These are not things that we're focusing on. We're looking at trying to find others that are not as well known. The reason I bring it up is it's another example of pushing the frontiers of modern medicine, and it is definitely happening. Obviously with therapeutic compounds and counseling and therapists, not just take a particular constituent. But for me, it's incredible that there's another whole frontier of medicine, that traditional knowledge, indigenous knowledge, in this case, sacred plants, is opening up to humans all around the world. I'm actually, I'm tremendously excited about that, to tell you the truth. I can barely believe it. And we're starting a small initiative in that as well. And I think since I may have lost you, I think I'm probably still here. I'm gonna, as you requested, continue chatting about other, there she is, you're back. Hi. I'm going to, let's see, continue, I guess. You'd asked about lessons learned. I think lessons learned from our experience are things take time. Things don't always go the way you want them to go. One needs to be honest about one's failures and successes. I managed to go to a variety of indigenous community meetings over the years, and at times I was not always well received. I was treated cordially and kindly always, but there's this history of exploitation. When a gringo shows up, no matter what their patina, it's not always well received. On the other hand, I had a tremendous experience with Awahun in northern Peru. Went to a public meeting with about 150 people, community leaders, the president of the community, mothers, teachers, local officials, where we talked about what we're doing, about pricing. We talked about the history of exploitation, what has not worked for them, what they're angry about. I apologize on behalf of those that I could, because what has happened, obviously in the rubber boom and other periods of time, was beyond horrendous. And then after a couple hours, we walked down to the local sacred waterfall where the kids were jumping in, and I got to jump in. And so did the chief. So that was fun. I mean, like Mark said, some of this is supposed to be fun. I think we do this, a lot of us, because we love it, and it's a privilege.
And it also makes me think that it's easy to criticize things from the outside, and that the real change happens by stepping in, being able to acknowledge our position, where we are, and trying to take steps forward, to listen better, maybe, to really have that idea of reciprocity all the way down into every interaction.
Yes, I completely agree. In fact, listening to, I think it was somebody from Herb Farm, I mean, when it's a mission-driven organization, it infuses the choices and decisions. There has not been resistance ever within our organization to providing really significant resources towards reciprocity, towards benefit sharing, towards reforestation and management. And that includes more medium things. We brought scientists and other levels of people into our laboratories. So when it's from the core, like your colleague had said, it's much easier to execute. Although there's the financial realities, we had some difficult times. So this is a very difficult, expensive process. You can't just put it in a bottle and label it and send it out, as you know. So there's the push and pull of that too.
I love it if you could talk a little bit more about that, because it is what makes the drug development process so unique. And you all are unique in that world because you are having this larger mission.
You mean talk about the difference?
The financial challenges and the issues.
Sure.
I mean, because it also seems that the slowness that is built into that has also allowed you to take the time to develop relationships that perhaps are more enduring than those if you could have been quicker.
Absolutely. As many people look at me and say, you're still doing that sustainable harvesting stuff. I mean, 30 years, you got to get a life, man, seriously. But indeed, that time and the FDA requirements, the clinical trials, the safety, those take a lot of money, sometimes $20 million for a trial. And, most people in the phytomedicine or herb sector, when they hear those kind of monies, their eyes roll. That's ridiculous. So that indeed provided the time span. It also provided the resources along the way to invest in those things, particularly with the plant that cannot be made synthetically. So it's a strange and distinct model from the phytomedicine or herbal product development, of which there are many that have tremendous amounts of science and clinical trials and investment, and get different levels of approval within the regime, say Europe, phytomedicine regimes and so on. But it definitely gave us the ability to do exactly what you just said, along with the field research relationships. Since those could take a year or two to develop, we could take the time to do that while we were doing other ones that didn't demand as much time to put in place, but always with the conversation, obviously with the governments and the communities. But yeah, you hit it right on the nose. That that is a unique circumstance. And many companies, small companies, biotech companies fail. They don't get a product to the market. They can't tell this story. They can't have the delight to work with communities because it didn't pan out. It's a tough environment, the pharmaceutical and biotech.
So two different threads, but one, the comment that your friends have made, you're still in this. What for you is the kernel of that keeps your passion? Because
well, to be honest, I feel astonishingly fortunate to be able to do what I love and what I believe in. I get up each morning thinking about how I could do that better. When I get to work with the community, my colleagues Mario and Cesar, I believe in it. I think it's a way to make a little teeny weeny change on the planet by doing something a little bit different. I believe in the patients, the people that are getting benefit from it, and I definitely thinking hard about the cholera patients that we would like to get the second generation product for. I know Wade mentioned his dad. My father, whenever there's a cholera outbreak, sends me a note saying, "Can't you send that medicine there?" And I have to explain, well, there's regulations and regulatory things, but so it's something I believe in. I could do it 30 more years, to be honest. And I'll be honest, the best part is going to hang out with people in the forest and learn from them and laugh and smile and play. And then, you know, at times have challenges of these issues, but it's a privilege. I love it.
and also, you know, I thinking this is an industry around health, the botanical industry, as well as the work you're doing. In not all cases, but in many cases, the health of the end product is very disconnected from the wellness of the communities or the environments along the way. And so again, I'm very struck by this model that, and it, economically, you know, the business depends on it, right?
Yes.
Helps create an incentive. It's not just a moral responsibility, it's that too, but the weaving together seems critical.
I could not agree more. And the conversations we've had with partners there about, well, who are your clients? How do you sell it? How does it work? We are truly interdependent, and we have been able to do things that make us feel that we are making real changes. There's a school in the Napo River that brings indigenous high school kids together, and they asked us for some 27 hectares of land to do agroforestry work on and to grow food and stuff. We happen to be given some land. It's a long story. We don't own land in general, but we were able to do that, and we were able to pursue that through the Ministry of Education in Iquitos, where the land was specifically titled to that school and only to the school. So those things are tangible, small things that are meaningful to the people on the ground. And the ability to do and be in those relationships, I'm sure is one of the goals of the phytomedicine industry and their multiple sourcing activities, but oftentimes they get so much, it's hard to keep track. And there's some limits, of course, on what they can do. So it's very rewarding to be able to have those tangible, direct relationships over time. As you said, that's been fantastic.
Well, because often companies in the dietary supplement realm don't have that direct connection because they're buying through intermediaries.
Exactly, and that's I understand that. I'd like to see more potential return from that industry where possible, though I know many companies are doing great work, and it is a different dynamic. I personally know people, and I go back, and I go back, and it's the same gringo. And I'm not making all this happen day to day. It's my wonderful colleagues who are on the ground every day doing it, and they've all had COVID, by the way. It's a scary time to be doing anything where you have to leave your house.
Yeah, and could you talk some about the impact of COVID?
Yeah, I mean, like I said, all of my colleagues in Peru, key colleagues have had it. Fortunately, they've had light cases, but the indigenous communities, you're talking 7,000 Awahun, 3,000 Shipibo. You've had elders and healers. I know you've talked with some of your colleagues who have passed away, the vestiges of this knowledge, who've been wanted to help treat their communities. People like Payakan, a Kayapo healer, and a Kayapo leader who I got to meet, a good friend of Elaine, he died. I mean, it's a huge loss. And even the efforts to stem the impact have had unintended consequences. So sometimes they improve, they sent, educate a Ministry of Health people on boats to remote places to deliver PPE and stuff like that, and they brought it with them. They didn't have it before they got there. That's you know, just tragic, and it's still going on. In fact, in the highlands, it's even worse now than the lowlands of Peru, as I understand it. I did see one thing that brought my heart joy. I mentioned to you the video about the Siona of Ecuador collecting medicinal plants, making treatments for communities for COVID, and then delivering them to neighboring communities. A film made by Siona youth with elders going in the forest, and that is sort of the full cycle where, so you don't need a gringo, you don't need a company, you never did, but you're utilizing your local traditional medical resources to assist each other. And that gave me great joy, frankly, because obviously those people are there, they have the knowledge, and they know how to take care of themselves pretty well, actually.
It's a great video, and for those of you who get the Sustainable Herbs Program newsletter, I included the link to that in the most recent, I think, the January newsletter. It's a video in the New Yorker, I think.
Yes, yeah, exactly. And like I said, the COVID thing is of course, as we know, it's not over by any means in Latin America. And I think the more remote communities have had some benefit of being a little less in contact, but the thing has spread so much that there's almost no place that you can really be completely immune from it. So it's had a devastating impact on traditional indigenous communities in the Amazon, as well as other parts of the planet, of course, but that's one that I'm familiar with. And it's, well, it's kind of breaking my heart, to be honest. It's very painful and very sad. There are other treatments being used that seem to have benefits that are not used here, but that's another conversation.
Is it impacting the work you all are doing there?
As some of your other colleagues have discussed in India and Nepal and so on, it has slowed things down a little bit. Obviously, we don't want anybody to do anything that puts them at risk. On the other hand, communities still do need and want resources for a variety of things. So there's still interest in doing what they're doing. And if they're doing reforestation, they're just amongst themselves in their communities. They're not having any really outside contact. So it has slowed things down a little bit, but hasn't put a chokehold by any means on our ability to source and to go forward.
Mm-hmm. There's a whole bunch of questions in the Q&A, so maybe I'll look through and ask you some of those.
Okay.
Or if you want to look through too.
Oh, in the chat room?
And no, this isn't a question and answer. Here's one right away. This is kind of a big jump from what you were just saying.
Well, the question hasn't come through, and since we chatted about this, I will continue to address other topics until you are able to come back. One of the, oh, there you are, go ahead.
This was why the barrels of the material were sent to India and Italy for purification, and if there are ways to purify it closer to where it's harvested. Understood.
We have been quite eager to do the value adding of some of the steps of extraction and purification in, obviously, Peru. We've had a variety of discussions with potential partners who could do that. One of the challenges that we face is all this is heavily regulated by the FDA. Each year you have to comply with the chemistry manufacturing controls and specifications. Then you have to follow good manufacturing practices, just as is being implemented more and more in the dietary supplement industry. Those are costly, challenging, and highly technical. And we've been trying to identify a partner who could do at least part of the first step. And all that, of course, would have to be approved by the US FDA. So the adding value by doing it, say, in Lima or another major city would be the goal that we hope to do. In terms of in the forest, there's not much more that a community or a family would do to add much more value at their point, but we are heavily involved in a fair trade relationship with our partners. But yes, a value-added process in Peru is one of our goals.
Mm-hmm. Sorry about that, I kept cut off again.
So if you have other questions, I am eager to answer them. Oh, there you are.
By Paul Cox. He wanted to know how the mechanism of action of Crofelemer differs from other anti-diarrheal drugs in plants.
Oh yes, of course. So it's actually completely unique. It's a first oral botanical drug approved by the US FDA. The mechanism of action is it's an anti-secretory, which is to say that it helps reduce the flow of chloride ions in the luminal side of the intestine, and so you lose less fluid, but you don't become constipated. Therefore, you can take this every single day if you need to, as do HIV/AIDS patients, as might COVID patients, whereas there really is no other anti-secretory drug in the market at this time. Lomotil, a tincture of opium, things that people are familiar with, those are anti-motility. They stop the movement of feces in the gut, and you actually get constipated. You can't take them for more than a day or two. In fact, they were giving them to kids in the Himalayas a long time ago, and it caused death. So children are particularly susceptible to anti-motility agents as possibly causing mortality. So this is unique in how in its mechanisms of action, and it's extremely safe. It doesn't get absorbed in the bloodstream. It doesn't go into the liver or any of the organs, so you don't have drug or phytomedicine drug interactions. That's another aspect. So it's really it is a unique first-in-class mechanism of action to manage the loss of fluids, which is why, like in cholera, people die in the first 27 hours. It could make tremendous benefit, this second-generation product, to stopping that mortality.
Mm-hmm. Someone asked whether there's a risk of an unfriendly company taking the seeds and replanting them, but it seems this is a pioneer species, right? And so is there, or maybe the question is around controlling the supply. Is there a risk or an issue with that?
If there's a couple questions in there, controlling the supply and might somebody still seed, they did it with rubber, they did it with cinchona. We're not doing it. We've been asked multiple times, hey, what about taking seeds and taking them to Southeast Asia? Well, first of all, it's part of the genetic resources of the country of Peru and the other Andean countries. The Convention on Biological Diversity and the Nagoya Protocol, you can't do that without getting the country involved permission. And so we have no interest in doing that. In terms of, it's interesting, this product, the latex, is actually sold all over the world. There's exported from Peru to 30 or so countries, and it's pretty small quantities. They even make, Lady Gaga makes a mascara out of it, at least she promos it or something. But the point here is that it's in trade, and we're one of the largest players, if you will, in this because of our products. But I haven't seen a lot of indication that the other exporters are involved in sustainable management or reforestation. Some say they are, but I've seen very little evidence of that. And that way, I'm happy we're doing what we're doing, because even if some portion of what we do, our teachings, our technology exchange, if it floats out and helps other communities produce this for the market beyond us, it helps keep it sustainable and helps resources coming to those communities. So we don't really control, we control what we are working on, but there's an existing market outside of what we do, including you can buy it in Boston and New York and Washington.
Mm-hmm. Yeah, I used it once for an infection.
Yeah, it's great for that.
Mm-hmm. There was another question that, again, sorry, there's a lot of questions to. This was about access to information. So by Yoko, how can we better deal with situations where the information and data provided by a community are behind a paywall or in a language that is not understood by the community? Do you think communities should always be given ownership of the data and researchers to provide with summaries in the community's plain native language?
Completely agree. I think Kelly Bannister will be able to even talk about that in enormously great detail in terms of research protocols and where we are today in terms of making certain that that happens. What we did in our work in the early days, we would take the data that we learned, we would send it back to the partners we were working with, often in the local language, and we would tell them what the tests were. We would tell them if it had efficacy for the indication that they talked about, we would tell them what we found. In many cases it did, like East Africa, we found plants used to treat people with infection with HIV, that the plants actually did show anti-herpes activity in vitro. Sometimes they wouldn't show activity, but we wouldn't tell anybody just because we didn't find the activity, it doesn't work. Sometimes when we send back the information, it's saying that it's worked, the healers would say, oh yeah, what's the big surprise here? I mean, what you think you're telling us something we don't know? So I agree that that should happen. We did our best to do that with all the data with our partners. I know we didn't get to every single community in every single language, but I think that's the protocol, I think, for general ethnobotanical research, and it is indeed what should happen. On the flip side, though, is some of the stuff gets published and then it goes in the public domain and then becomes accessible to both phytomedicine companies as well as any potential pharmas, and that's good and that's bad. There's a lot more traditional knowledge databases being used, for instance, by intellectual property offices to help guard against the inappropriate exploitation of that knowledge by parties who have not put in place agreements and contracts and so on. So we're getting far. I've seen tremendous advances from somebody saying, oh, that was just some knowledge, whatever, to, oh no, the European Patent Office consulted traditional medicine database of India, of the Philippines, of Peru, wherever. We have found prior art, therefore you, a company trying to do this, cannot file a patent on that, which is of course one of the goals of the Convention on Biological Diversity, is the fair and equitable use of and sustainable use of genetic and plant resources and traditional knowledge.
And I was going to ask about the Convention on Biological Diversity. Has that been something you all have navigated in doing this work, or is it?
Oh yeah, no, we're actually, I can say with pride, we sort of put in place our benefit sharing activity and vision before the 1992 Rio Convention. That has then since evolved the Convention on Biological Diversity to the Bond Guidelines to the Nagoya Protocol, evolving, being embraced and ratified by a variety of countries around the planet. We've been extremely focused on trying to be as compliant to the norms and requirements. As you know, the United States did not, become party to that convention, or certain parts of it, which is irrelevant. Just because the U.S. didn't do that as a country doesn't mean we weren't and are highly focused on it as part of our ethics, part of our guideposts. And we published and presented at a lot of those meetings discussing what we were trying to do, how we did it, to the point where some sectors of the botanical medicine and or even anthropology community said, enough, we're tired of hearing about this. But the reason we did it was because we wanted to be as transparent as possible. And occasionally we might become targeted by a group that decides we didn't do this or that right, and we can produce the publication, which usually has local scientists and others part of it, and say, hey, we ain't perfect, and not everything went exactly perhaps as everybody might like, but here's what we did, and here's how we did it, and here's why we did it.
Yeah, it's very easy to criticize the, drug development, pharmaceutical.
Yes, and as I pointed out, historically, the phytomedicine sector is not, I should say, removed from those same obligations. They in fact have them. That Union for Ethical Biotrade that you're going to talk about, the teas and stuff, they're bringing more of the cosmetic and tea and other companies into line with all the things that you're talking about in your sustainable herbs program. So I see great progress across all sectors at this time in that area.
One question kind of connected to that, how, there's a lot of claims out there about sustainability and all of these things. What are there key things you find to help detect whether a company is actually walking their talk or if it's just greenwashing?
Yeah, I mean, there's an awful lot of people making that claim. I see not a great deal of specific data and information, although many of the good companies have it on their website. They'll show, and as you and I talked about, I love this one company in Brazil, I think it's called Origins, where you can flip the label back and take your phone and scan it, and it will take you to the community, the place, and the situation where the thing is sourced from. So as a consumer, which is harder to do on a pharmaceutical bottle, that's for sure, you can't, you can find out where, who, what, when. I think that the way to separate the, if you will, the people that are utilizing or exploiting that sort of we're sustainable, we're ethical, is show us, show us who, how, where, what, when, which isn't that hard to do with websites and stuff. So there's plenty of great ones. I'm not trying to be dour or think that we're the great guys. There's plenty of them, but there's plenty that aren't. And there's so much room to basically be transparent and talk about what you're doing.
And for us on the end to ask good questions, right? Because we have to know really.
Yeah, I mean,
How to go
the
beyond.
tension is everybody would like to get things as inexpensively as possible, as you know, on the consumer side. With COVID and depression and anxiety and immunostimulants, there's been a massive boom in people wanting these for all the right reasons. And yet that pressure of cost, people don't have money. We've got the problems of the economy and job loss and so on. So companies want to make it accessible, but they also want to do the right thing. And that's the tension. I'd say, I hate to say it, but consumers probably have to pay more. That's one of the ways that you're going to get a little bit better compliance with that. And that's a big ask for some sectors, and certainly companies that have 100 products. But I personally think that that's kind of like, you're going to have to put your money where your mouth is, or where your health is, and that be to the health of the people and the places and the environments that it comes from. I know that's part of the things that you think one of your whole driving force of your work, and I agree.
Yeah, and maybe do less and spend more on what we do. Yeah.
I'm sorry, say it again.
Purchase less, fewer things, and invest more in what we do purchase. Quality.
Yes. And the cheapest thing is going to have an impact in that it's not going to be able possibly to do the bigger holistic One Health approach to people, planet, culture, and business. And that's a toughie. I get that. I mean, we've had financial challenges, that's for sure. So it's not always easy.
Yeah. So we're coming to the end of the hour, and I wanted to ask one question that's more personal. So you have been doing this work for 40 years and in so many different communities and circles that draw on such different types of expertise. And I'd love to hear your reflections on what qualities in yourself you feel have enabled you to do this work. Or
wow, that's a great question. You know, I think like Lauren Isleson kind of mentioned, kind of getting out of the head and into the heart, things that I have such tremendous respect and admiration for the leaders, healers, people, families that I've been able to interact with. So I think anybody that gets into ethnobotany and really does it with people and places and cultures, I think has a kind of awareness of the great privilege it is to hang out with those people and understand the wisdom and knowledge and expertise and intelligence of so many different walks of life. So that has sort of fed me to say, wow, I want to continue learning and having the ability to interact with these amazing people and cultures and places. I think, was that kind of what you were asking?
yeah. I mean, what I hear you saying is kind of curiosity, but also a humility that you're not coming in with the answers.
Yeah, that's for sure. Like I said, in our sustainable harvesting approach, we asked them what to do. We didn't say, hey, we got some smart foresters from Germany and Madison, and we'll tell you what to do. It's like, let them, oh, here's what we do. You might want to do it this way. But yeah, it's just, well, it's fun. Like Mark said about the fun thing too. I mean, if you can't have some fun doing what you're doing, if you don't enjoy it, you know, I feel that at the high level, I'm blessed to be able to do it because I can put my values into what I do with people in a company that share those. So, you know, we should all be so lucky. I mean, I don't mean to be glib about that, but yeah, I feel very fortunate.
Thank you so much. Is there any final closing comment?
No, I want to start with what I end with what I start with. I admire enormously this whole series. I've enjoyed it. How you're doing, I think, is excellent. I think it's extremely timely. So thank you is my last message.
Thank you. Thank you so much for your work and taking the time to share it with us. And thank everyone who's joined us today. And in closing, I just want to share my screen again. To thank our supporters who have made this possible. And then just show you the link to the website where you can find recordings of all of the interviews. And we'll try and look at the questions, and many of the questions are answered in Dr. King's article in Herbalgram that he mentioned. I think it's 125.
Yes, that's correct.
That is available for members on the American Botanical Council website. And thank you all for joining.